Let's talk about seborrheic dermatitis and dandruff. These are two very common conditions, and it's important to know a little bit about them so you can address them well and actually take action, take matters into your own hands, and handle the condition in a way that's going to help you out. What are dandruff? What is seborrheic dermatitis? These are two chronic conditions. Dandruff is a condition that is characterized by having non-adherent, meaning loosely associated white flakes that are on the scalp and are shed off the scalp. Seborrheic dermatitis is dandruff's inflamed or angry cousin. So seborrheic dermatitis is characterized by pink or reddish or salmon colored patches or areas on the scalp, sometimes on other areas of the skin such as the eyebrows, around the eyebrows, around the nasolabial fold, and sometimes around the chest, the armpits, and even the genitals or the groin area. You can get those areas that are reddish or similar to reddish in color with flakes on them, and they can be either asymptomatic or they can be itchy or even burning or painful in very rare cases. And that's a condition that is very similar to dandruff, only it has an inflammatory component to it and it can be more widespread. So it can look more dramatic and it can have more symptoms to it. Dandruff can also be itchy, but most of what is bothersome about dandruff is the fact that it's there, that you're getting these white flakes shed off the scalp, and that is a big problem for a lot of people. It's unsightly. People don't like the fact that they have these white flakes on their clothes, especially dark clothes, and that's very disruptive to people's lifestyle and to people's quality of life. So these need to be treated. So what can be said about those conditions? Well, first of all, they are not infectious. Contrary to common belief or urban legend, they are not caused by a fungus or yeast, but they can be associated with a certain fungus or yeast that grows on the skin naturally, and specifically Malassezia species. And those yeast can actually become sensitizing to the body, in which case the body reacts to those naturally occurring yeast on the skin and can form a reaction, an allergic reaction or an inflammatory response to the presence of the yeast on the skin. So in those cases, the body can form or create or launch an inflammatory response to those yeasts that are found naturally on the skin. That's when those conditions, both the dandruff and the seborrheic dermatitis, can respond to antifungal treatment. And that usually is delivered in the form of shampoos, and in some cases it can be delivered in the form of topical creams or lotions that contain antifungal compounds or antifungal elements. When you apply those products to the areas that are affected, you're knocking down or you're decreasing the number of yeast on that given area, temporarily of course, because you can never knock them down completely. They'll repopulate the area, but as long as their numbers are down, the response of the skin can begin to decrease, and that would eventually yields the result in due time of calming down of the symptoms, decreasing the flakiness, decreasing the irritation, and decreasing some of the symptoms that are associated with dandruff and seborrheic dermatitis. That is, by the way, why the anti-dandruff shampoos of sorts, the antifungal shampoos, that is why the response usually takes a while to form, because the skin is not told or directed to calm the response down, but the actual reactant or reagent to which the skin is responding is going down in numbers, and then the response that the skin has generated will take some time to unwind. It usually takes a few weeks to unwind, so that's why anti-dandruff shampoos or creams take as long as they do. If you want to speed things up, in certain cases you can use anti-inflammatory preparations, anti-inflammatory creams, or other leave-ons, specifically steroids and what we call calcineurin inhibitors. And those are the two major classes that are used topically to control symptoms and to control the appearance of dandruff and seborrheic dermatitis. More seborrheic dermatitis than dandruff, because seborrheic dermatitis is decidedly inflammatory, whereas dandruff is usually not inflammatory so much as just plain reactive. Now, using those medications will speed up, when they work, will speed up the progress towards remission or towards calming down the symptoms and creating the relief that you need when you have those conditions. So, what do you want to do when you have dandruff? Well, obviously using the anti-dandruff prescriptions is a good idea, but before we do that, let's look at what not to do. So both dandruff and seborrheic dermatitis become worse when the scalp or the skin of the scalp or any area that is affected by those is dry and irritated or irritable. They're already irritating the areas, but when the skin is drier, it's actually having a harder time protecting itself and producing the elements that may help it maintain its integrity. So the more you wash those areas, the worse off you get. The more you cleanse those areas, the worse off you are. And if you use hot water, if you use any soaps or detergents, if you use any physical abrasives, which a lot of people are tempted to do, in the case of dandruff or seborrheic dermatitis on the face, a lot of people feel the need to exfoliate. All those things actually keep on digging you deeper into the hole, and prolonging your condition actually will slow down the response to treatment, which is a shame because all those things can be avoided. It costs nothing to avoid them, but it costs you dearly to actually employ them in the service of treating your condition, or supposedly in the service of treating your condition. So avoid using all these abrasive practices on the skin, anywhere on the skin, to make your condition worse. Then you can move on to using anti-dandruff medications. In people with very sturdy hair, very sturdy skin, you can use the shampoo. Shampoo will dry out the skin, by the way. Even when it is an anti-dandruff shampoo, it will create a dryness on the skin of the scalp or on the skin anywhere else it's used. So that needs to be mitigated by a conditioner. And on the scalp, on the face, you can moisturize to offset the drying effect of any detergent shampoo that you're using to treat the condition. And in some cases, you can actually use a topical medication, a topical antifungal, a cream, antifungal cream, for example. I do like the prescription grade antifungal creams for that reason, and I prescribe them, or I offer them for people who don't want to shampoo. And in certain cases, people who cannot afford to shampoo as frequently as you need to when you treat dandruff or seborrheic dermatitis, which is once every other day. In the more conservative approaches, you need to maybe use the medication once every 2 days, but you need to use the medication consistently and stay the course until you bring on the remission. So with people with very dry, frizzy hair, you cannot shampoo the hair every day or every other day of the week. It does not work. It'll basically dry out their hair. It'll bring on more symptoms, more issues than you're actually curing. So the cure is going to be worse than the disease. So you have to really adjust your treatment and your approach based on the characteristics or the nature of the person that is being treated. So for people who don't like shampooing, for people with very dry, frizzy hair, you can use a cream or a leave-on. And on top of that, you can use the topical steroids or the topical calcineurin inhibitors. And those can be very helpful. I suggest obviously orchestrating all of this with the help of a board-certified dermatologist who will actually tailor-make the treatment to your needs, as you have to have that discussion. The strength of the steroids, most of which are prescription anyways, are the calcineurin inhibitors, which are prescription-grade medications. The strength really matters, and the nuance of the prescription really matters. So I would advise getting a dermatologist on board, getting the treatment plan, getting comfortable with the treatment long term, and then sailing off into the sunset yourself, being your own boss. As soon as you have everything tailor-made to your needs and you're already in charge of the treatment, you know the ins and outs of the treatment, you know how to start the treatment, when to stop the treatment, and when to go back into the treatment, and how to maintain the results. These are very, very important questions to answer when you treat chronic conditions such as dandruff and seborrheic dermatitis. Now, on the bonus end of things, what's really important is that nowadays, and in very severe cases, by the way, there are systemic medications to treat very, very severe or recalcitrant or unresponsive cases of seborrheic dermatitis or even dandruff. Those include systemic antifungals. These are prescription medications. And in certain cases where the seborrheic dermatitis is very severe or even bordering on being what we call sebum psoriasis, which is a combination of seborrheic dermatitis and psoriasis, that condition can be treated with medications called biologics. They can be treated with other medications that are more old school, but biologics can actually make a big difference for certain issues of certain people who are afflicted with severe seborrheic dermatitis that's not responsive. Now, as far as snake oil is concerned, so snake oil is kind of a loaded term, but let's just talk about the natural or the less than regulated and less well proven forms of treating seborrheic dermatitis or dandruff. So there's a lot of medications out there that are purported to make a difference with seborrheic dermatitis or dandruff. Frankly, the evidence out there to support the alternative medications is not that strong. Tea tree oil can make a difference in certain cases. The problem with tea tree oil is that there's virtually no regulation over what kind of ingredient is inserted or incorporated into products that are tea tree oil products. So you don't really know what you're getting. You're getting, obviously, it is my assumption at least, that you're getting some form of tea tree essential oil that's infused into the product. But what's the quality of the ingredient? What's the concentration? What is the mode of application or the frequency of application? Those are things that you need to figure out for yourself if you're using a product like that. So I would use caution. I would tread lightly around these products, but you can definitely try it out on your own, see what happens, and always have the safety net of consulting with your dermatologist in case things fall through the cracks. Alright, well, thank you very much for watching this video. If you got some benefit from it, please hit the like and subscribe button. Thank you again for watching, and God bless.
Ryan Little.